During medical training, orthopedic surgery is not something we get a lot of exposure to in terms of actual educational purposes in the beginning. But it's something that rapidly became to me evident that you could fix a problem and you could make a significant change in somebody's life fairly quickly. And I think that's probably what drew me to it in terms of the surgical field. The most rewarding thing about my job is probably interacting with grateful patients in clinic. A very thankful patient will really just make me smile and make the rest of my day brighter. Whether it's helping a grandmother play with their children or their grandchildren on the floor, or getting somebody back to an activity they love doing, it really does it makes the job really rewarding for me. And honestly, getting a hug from an older patient is usually kind of the best thing that I could experience. If I were to say I had a superpower, I think it would be taking care of the patient as a whole. It's very easy in a subspecialized field like orthopedics, and especially total joints, to be focused on the problem that we're addressing, but you have to really take a patient as a whole into account. And some of my most successful outcomes have been people that we've efforted to get into, see other specialties or take care of other medical issues that have really improved their entire life. An elderly lady who had a very arthritic knee and unfortunately sustained a fracture below that. And her knee was so stiff that the fracture didn't heal, and really she couldn't obtain care anywhere else. And it was a fairly large surgery to get her motion back and also stabilize the fracture. But at this point she's able to walk on that leg and get around and is very happy with it. And usually it's managing someone like that really had nowhere else to turn, that really kind of is, I think, the best thing that we can do here. I think patients would be most surprised to find out that I'm a history buff. This area is full of rich history, especially in regards to the Civil War, which I am a huge student of. Outside of work, most of my time spent with my family. I have a 3-year-old and a 1-year-old, both boys, and they both keep me on my toes, and when I'm not at work, for sure. I spend a lot of time out at my in-laws. They live in the western end of the county, and my wife's from Morgantown, so we spend a lot of time out on their farm. It's a beautiful state. It is a gorgeous area to live. And the patients really are the best part. The people here are the most down to earth, the friendliest, and the most grateful for the care they get. And as West Virginia, it can be tough for those patients to receive excellent care, and I think that's what WVU Medicine's done a great job of, really giving us the ability to provide that care to the entire state.